protokolu yönü birinci bir çıkışımıdayım. Şu koronavirüs barada malumat verildik. Şoň üçin hem bizim Amerikada bizim bilýän doktorlarymyzdan bir sanak var. Board certified nurse sanak var, ona bilmedim. Bir de Doktor Kakageldi Hommadov çıkışı verdiğip çağırdık ve çağıran kabul eden için çok sağ olsun. Geçen yıl çıkış ettim. Ben geçen yıl yine fehmgatnaş bilmedim. Kabir sebeplerden kabir başka bir sebeplerden yöne bu çıkış etti dediler. Hani şunu hakikaten bu çıkış edeceğim kadar görülüp bu yıl yine çağırdık. Şimdi Doktor Kakageldi Hommadov Türkiye'nin Gaziantep Üniversitesi'nde utoran 2004 yılda girip 2011 yılda utoran. Ondan sonra Englewood Hospital and Medical Center'da 2012'den 2015'e çenni işlen New Jersey, Englewood, New Jersey'de. Ondan sonra Internal Medicine Resident olup Murphy Catholic Medical Center'da 3 yıl işlen 2016'dan 19'a çenni. Şu an olsa Temple Üniversitesi'nin Lewis Katz School of Medicine'ne Anesthesiology Resident olup bir yıl veri işleyen. Amerika'da Board Certified Physician. Köp sağ olun yine geleniniz için. Şu Covid var da bir de bir malumat verseniz. Doğru olanı bizim karışyanımız 20-30 minut çıkış. Ondan sonra sorular var olsa şu sorulara cevap verirseniz. Şart olur azıcık iyice alınması için sizin muman 50 minut vaktiniz var. Ondan sonra son çıkışımıza devam ediyor. Sağ olun.
Selamun aleyküm iyileşler. Sağ olun çağrınız için. Türkmence ediplerim kam presentation manver deneyim.
Türkmence gurlan eğer terminoloji İngiliz şuranlar varsa kullanırsınız da.
Var. Anak çok eğer zorluk çektim İngilizce geçemem mahmal bağışlarsınız da. I'm going to start sharing my screen now. Hormatly işler COVID-19 güncel topik değilen yali. Şoň üçin o hakkında adaktenek size malumat vermek istedik. Tehniki terminoloji köp bolup biler. Şoň üçin men çaltyrak geçerin ýüzleýärek onuň presentation gutoran tamam inşallah bir 5-10 minut soru jogap üçin wagt aýryp bilsek has gowy bolar diýip pikir edýän. We gaýdyşýaly men internal medicine residency training gutordum Philadelphia'da 3 ýyllap şu adam ikinci residence training edýän anesteziologiyada. İnşallah belki 2 ýyl soň anesteziologiyada diýinýär. Ondan soň bizden bol etmek hyýaly bar. So I'm going to give you a little background. Coronavirus näme nerden gelip çykdy hakynda. Ol öňden bilinen virus esasen hayvanlarda ketel edip bilýän virus. On täze görnüşi täze görnüşi 2019 ýylyň soňlaryna dekabrda ýalňyşmaýan bolsam Hytaýyň Wuhan diýen şäherine peýda boldy. O taýda nädip tapdylar buny? 5-6 tane doktor reanimasiyada işleýänler bir-birine meňzeş pneumonia bilen gelýän, pneumonia bolsa öýkün iltihaplanmasy bilen gelýän hastalar bir-birine meňzeş bolan soň gün geçdiginde köpeltdir bir-birine meňzeş gelýän presentationlar. Şonu iýdarlap şeýdip tapylan bir virus. Ol bir kepden içerisinde Hytaýdan çykyp tutuş dünýäye ýaýrady. WHO Dünya Saglyk Organizasiýasy şu ýylyň fevral aýynda ony COVID-19 diýip adlandyrdy. Mga eýle kad SARS-CoV-2 diýilýär. Näme üçin SARS diýilýär? SARS-yň açıklaması severe acute respiratory syndrome coronavirus 2 ön 2002'de on birinci görünüşü SARS deyip virüs yayraptı Xitayda olam şuna mengdeşrak ketel ediye esatanam so neme öykön yollarını tutya the transmission is also similar droplet bilen neme diye üsküryan şol üsküründeki dropletler havada galya onu başka bir gidip demalya şey büyükünne geçiyor ya da üskürya el üskürya tam bir elleşya olam elleşen adam mağdına eline ağdına ot eltip şolar yalaydı bulaşan burada bol 2012'den 2002'de şol SARS çıkıptı Xitayda 2014'ten ve 2004'ten beri täze vakalar yok. Şoň üçin onu SARS 1 diýip kabul edilýär bolam SARS 2 SARS-CoV-2 ikisem koronavirus nemetine değişli maşgulatyny değişli so Mart'ın 11'ine WHO mani pandemik diýip kabul etdi COVID-19'i Amerika Birleşik Devletleri Mart 13'üne mani national emergency diýip kabul etdi. Düýnüň sanlary bu dünyada 7 milyon 27 milyon vaka boldy olardan 413 bin ölüm vaka COVID-19'den Amerika'da olsa gideta 2 milyon vaka olardan 115 bin adam öldü 620 bin adam goğulaşan. Bunu Johns Hopkins University Public Health Department var şolong vakalar be. Bulan virüsün mikroskopik şekli aydışım yali SARS coronavirus in English receptor gene binding region şu öýjüklere nähili girýär şu ACE2 diýip bir receptor var that stands for angiotensin converting enzyme esasen öykünne bolýar şol reseptöre baglanýar gelip virüs onuň şey diýip ketel bulaşýar adamdan adama çağalarda şu gene şu receptor is not developed that well yet. That's why it doesn't infect the kids that much compared to adults. Şoň üçin çağalarda ýanky reseptor ad bolan o sebäpli bu ketel çağalarda gaty can erwet ketel nemeden ok. Başka da şu koronavirüse değişli bir virüs Middle East Respiratory Syndrome diýilýän virüs olam Saudi Arabistanna tapylly 2005-2008 aralyklaryna töwerine boldy meňe atlaşmara nemelerde camel düýelerden bulaşanlygyna inanylýar. So it appears like the bats are primary source. Bats will yerganatlar. Esati şolardan bulaşanlygy tahmin edilýär. Olam toşun belli der if there was another intermediate host before it came it spread to the human yet. Amerikan Birleşen Ştatlaryny ehli 50 ştatda da COVID-19 vakalary report edildi. Diňe Antarktikadan başga kontinentlerde hemmetine bulaşan COVID-19 vakalan sany it depends on the population density and demographics. Eger ani ulu şäherlerde adamdan köp bir-birine yakın yaşayan yerlerine vaka sany köp demographic wise eger ani garybrak yaşayan yerlerde bir komnatlarda 7-8 adam yaşayan maşgallalarda köprak bolýar. Also it depends on the extending of the testing and reporting as well as time of mitigation strategies. Mitigation strategy diýmegem ani şu ştatlaryň bu virus durdurmak için ediyen tağallaları, hani stay at home order, wearing mask when you go inside and whatnot. Where long-term facility, where homeless shelterlarda it has caused outbreaks, especially the nursing homes and whatnot, and the jails. Nad bulaşya adamdan adama esati bulaşan mekanizması occurs through close range contact, mainly with respiratory droplets, as I explained earlier. Namolya adamlar üskürüya, askarıya ya birbirine yüz yüze gepleşturka yank aerosollar havada geziye onum tindemal içine alyan şeydi bulaşya. Aerosollar gözüyle görülyen da telollar haskiçi. Yönü yank dropletler typically do not travel more than 6 feet. Yani 2 metreden köp travel edeno kan üskürsangam askarsangam gıygarsangam sigarsangam 2 metreden kan gidenok yank ağzından çıkan ya burnundan çıkan yank dropletler. Şong için this is why it's recommended to stay 6 feet apart from others. Airborne precautions are universally recommended. Airborne precautions dimem yank maska dakmak ağzına esasanam I'm going to talk about aerosol generating procedures later on. But esati bulaşma şekli yank droplet şeklinde adamdan adama bulaşıyor. Fecal oral yani bulam hani fecal oral dimeme neme adamın dışkısı bile bulaşıyor mi hani hepatit aşıları yağlı bulaşıyor, hepatit yaşın yağlı bulaşıyor ya da gani yolu bile bulaşıp biliyor ya da başka diyelim elin sadece kesilli sadece gana di ya açık bir yarağma şong üstüne droplet geldi bulaşıp biliyor mi olur yağlı bulaşma şekli yok esasen droplet şeklinde. Viral shedding and period of infectivity. Viral shedding demek haçın diyelim bir adam hasta oldu COVID-19 bilen haçın yanka adam virüs yaratıyor. Haçın başkaları için tehlike başkaları için danger şu hakkında görülmek çiberde. COVID-19 esasen infeksiyon ilki stage'lerine contagious deyip kabul ediliyor. Esasen kavir kişilerde simptomları orta çıkmankada adam birbirine bulaştırıp biliyor. Isolation of infectious virus from upper respiratory specimen more than 9 days after illness has not been documented. So the symptom ortaya çıkan son dokuduğun son bulaşıcılık düşüyor yani infectivity oranı demediye ratio düşüyor. Risk of transmission depends by the type and duration of the exposure. Eğer yakın if you stay in a close contact environment, and it depends on how many hours of the exposure you have been exposed and what kind of preventative measures you've been implementing. Man diyelim maske giyen yok mu bir oton içinde bile mi ya da bir maşinle 5 saat yolculuk ediyorum olur itkiyaş nemetine göre. Exposure nemangora. Secondary infections has been described among household contacts, healthcare settings when appropriate PPE was not used. PPE demek protective person protective equipment demek. What was I gonna talk about? The secondary attack rate. Eğer diyelim bir sizin maşkalarınızda biri hasta olsa sana bulaşma nemesi risk neçerak. Symptomatic secondary attack rate 0.45% among 450 adam eğer 10 tane hasta var şu on tan hatta 4 yıl adam bilen bağlanışı bolon yani aragatnaşığı olar hassa bağıtı çoğun bulaşma riski nol yani yarım prosente yakın. Eğer sen maşkalar daha sonra burada yaşayan olsan ol 10%. Amerika'da yapılan edilen trial'la şu rate'ler tapılıyor. Karaya edilen şuna mendeş yarım prosent eğer sen yönököy aragatlaşın olsan eğer uyguçuna bile yaşayan olsan olam 7 yarım prosent. Environmental contamination. The virus and contaminant service may be another source of infection, especially if there is susceptible individuals touch those areas and then transfer the virus to their mucous membranes in the mouth and ears or, I mean, not ears, eyes or nose. But the frequency and relative importance of this kind of transmission remains unclear. Hayvanlardan bulaşan, hayvanlardan bulaşan sen eğer infeksiya geçirten COVID-19 tədədən infeksiya bolup tədədən COVID-19 bulaşıp bilyam sana o hakkında once you get infection the induced protective antibodies demek immün sistemin şu virüsüden karşılaşandan son organizmin antibody demediya produce ediyor. Onun indikiyedek şu virüsle gavatlaşanla immün sistemin o virüs uje tanıya. You already have antibodies in your library. Then that antibodies get produced and gets like mass production, and then it attacks the virus and virus goes away. So it's thought to be protective antibodies, but it's not yet known whether all infected patients develop a protective immune response, or how long that protective effect will last. İnkübasyon periyodu 14 gün köplönç eğer virüs bilen hastalanan bir adam bilen aragatlaşık bolonun son 4-5 günden son uje sen symptomlar çıkıp buraya. Pneumonia is most frequent serious manifestation of the infection. Pneumonia also öken ketele öken the virus dolya. Approximately 15% of patients developing severe infection with hypoxia, dyspnea, and extensive pulmonary involvement. Hypoxia demek ganındaki kislorod demesinin düzeyinin düşük olmağı, dyspnea also demutma, extensive pulmonary involvement, pulmonary means lung. Başka nahil simptomlar olup bilya, gızdırıp bilyan, ısırıp bilyan, demutma, upper respiratory tract symptoms like burnun akması, mışsalan ağırıp bilya, kavırkşi, içi geçivilya. Some patients also report loss of sense, smell, as well as taste. So clinic presentation is like it ranges widely from like asymptomatic to like severe infection, severe life-threatening respiratory failure. As I mentioned, typically occurs after 4 or 5 days of exposure. 10% virus kapan adamların 10% they will have mild diseases. That it means that they can be treated at home. Along 20% ciddi şekilde keselliye onların hospital'a gidip beceri alması gerek ya. Pneumonia we mentioned, ARDS we're going to talk about. And the case fatality rate is 2 to 3%. It means that once you get the infection, what is the percentage of you dying from infection? It's 2 to 3%. The ARDS is the severe form of respiratory failure due to lung involvement because of the coronavirus, and we're going to talk about that in a bit. That's the leading cause of the death, by the way. recovery. Net adamlar net sovatta gutulya ketellen. If you have mild disease, it's 2 to 3 weeks of recovery time. If you have a severe disease, it's 3 to 6 weeks. So these are the clinical features. We already talked about most of them. Fever, cough, dyspnea, anosmia demek yankı ithalmang the problem olması, augesia demegam tagamang almang the problem olması. Sore throat, boğaz ağrıması, kas, the mışsalan ağrıması, chills, rigors, balam üşütme titreme, baş ağrısı, rhinorrhea, burnun akması, nausea, vomiting, we all know, diarrhea, iç geçme, fatigue, nemetmek, yorgun, sıkıntı duymak, confusion, also nemang the consciousness and the problem on the chest pain pressure goes in the outer one. So this is ARDS is the major complication in patients with severe disease, and it can manifest shortly after onset of the dyspnea. So this is the major complication that why people end up in the rhinomascular or the namchunyatan machine valan man the other complications could be thromboembolic events. What this means is that you get like blood clots in your legs, in your lungs, sometimes in your brain. You know, a problem there is no specific clinical feature that can distinguish from COVID-19 from other viral respiratory infections like flu. Gripe den tapatlandrmochin they all look similar. It looks like the flu, but it's more infectious, and you end up in a severe disease in a short period of time. So who are at risk for a severe disease? Sen ağır şekilde hastalan man riski hatkıp eğer sen yürek keselin ma olsa, diyabetin ma olsa, hypertension, davlenyan ma olsa, kronik uygun hastalığın ma olsa ya da kanser, rak keselin ma olsa, obese olsan, çilin çekyan olsan, uygun, the liver, bağır keselin ma olsa ya da immune system uncompromised. What that means is if you are on chemotherapy, it means you are immune compromised. If you have some sort of rheumatological disease and you are on some sort of biological medications or steroid therapy, that means you are immune compromised. So these are some imaging examples of COVID-19. The one that I'm showing on the left side here is the CAT scan of the chest. The arrow that healthy öykün, normal öykün kapkara olmalı şular. Şu aktatlar bolmalı. Şu aktatların şulara buz ground glass opacity ile hani cam gışın buzdan yara. Şondan angrasıda seyredin şu buzlu cam yalı ya. That's why it's called ground glass opacity. So şu ak yerler var bula septum öykünün bir bölüğüne ile bölüğünün arasındaki septum galınlaşan şuradaki pleura değil ya bulam nemang daşındaki membran öykünün ol galınlaşan these are all ground glass opacities. Bul onurgo bulam yürek. Bura CAT scan bulam chest x-ray bulam yönüköy öykünün röntgeni. Enable trachea, ikiye bölünüyor şurada. Buluna sağ kaptalıyken, bul çep kaptalıyken, bul yürek. It looks like this patient had heart surgery before. This is sternotomy wires. So this bulam şuraya şurada kapara olmalı. Şuradaki ağıran yerleri, it's called opacity. This has the ground glass opacities. Also the pleural thickening that the membrane galınlaşma. So ARDS, we talked about ARDS a little bit. It means that acute respiratory distress syndrome. This is acute diffuse inflammatory form of the lung injury. Şul öykünün ingiç gaz exchange'inin bol yani ingiç öykülerine alveol değil ya. Şul toğolaktattır where is my cursor? So tålak that alveol. Now dashin na vela gök bulan vein gudul bulan artery. Karaç müşünde şundan şörden ga emegelia oxygen demalangda. On şu alveolar membrane surface that ganaylan şkolya berden gelen venous gan berden gelen arterial gas. The arterial gas şörden gelen oxygen ve venous sistemden karbondioksit geliyor. Kümürtürüşü gadi. Ola içerik giriyor alveola. Normalde onun oksijenem ganın içine giriyor. Yani gandan gelen karbondioksit öyküne geliyor. Öykünden gelen demalan oksijenim hem gana giriyor. Gas exchange oluyor. But when you have ARDS, that alveoli sac is all filled with inflammatory fluid like this. It should be empty. So when it's full with the fluid, inflammatory fluid, the gas exchange gets compromised. That's why you get that's how you get ARDS.
Dr. Hommadov, if you have 4 minutes.
Oh, really? Okay, so I gotta go faster.
Questions, so I just want to give them more opportunity to answer.
Sure. Ulam CAT-scan ARDS'in ciddi hat deme görünüşü. These are other complications. Arrhythmia, acute cardiac injury. Arrhythmia means the rhythm problemati, shock, heart failure, thromboembolic complications. And usually, if you have severe disease and you're being treated for ARDS, there is a syndrome called cytokine release syndrome. This usually kills the patients if you do not recognize on time. We're not gonna talk about that. The WHO and CDC recommends all symptomatic patients of suspected COVID-19 should undergo testing in ideal circumstances. Test dahil ediliyor. The microbiological diagnosis is the main diagnostic tool. The PCR de test var. Şöyle ediliyor. Burnun arkasından swab bilen Q-tip yaradat bilen you get a specimen and you do this nucleic acid amplification test. Serology test. This is the second form of the test. It's a blood test. You take blood out of the patients who have to see if that patient had COVID-19 antibody or not. So that the serology test checks antibodies. So it does not necessarily diagnose you. It helps to identify which patients had the disease before. And so when the government was trying to use this test to let when they were trying to reopen and to see and plan to give them like some sort of immunity passports. So it relies on that serology test. Laboratory test, I'm not going to talk more about, not a whole lot about it. So severe lymphopenia and high D-dimer levels are associated with severe illness and mortality. Lymphopenia demek gan hücrelön gan hücrelön gan ad olması. D-dimer diyen adam ganın pıhtılaşmasına coagulation. If it is high, it means that there is some sort of coagulation issue going on. And these are inflammatory markers. So when you have inflammation and infection, these markers go up, and the more the higher they are, the more the sicker you get. So treatment-wise, there are no drugs and other therapeutics presently approved by FDA to prevent or treat this disease other than remdesivir. So the main treatment is supportive care. It means that if patient is hypoxic, you give oxygen. If they can't maintain their oxygen level on their own, you put them on mechanical ventilator as indicated and treat their coexisting medical issues and complications. So on May 1st, 2020, FDA issued emergency use authorization for this drug. That's called remdesivir. That's antiviral drug. And it's recommended to use in adults and children in a hospitalized setting only with severe disease. So since it was expedited approval, it was shown to shorten the time of the recovery in some patients, not all of them. Since there was no other medication that was shown to be effective, FDA issued this emergency authorization. However, there is limited information about safety and effectiveness. So if you guys go into this link, you will be able to see all other investigational drugs, and they keep updating as the more data emerged from the trials. What about hydroxychloroquine? I wanted to do humor a little bit, but we can pass if you want.
Yes, we have 13 questions, so.
Okay, all right, I'm going to stop.
Suat 13'dan sorumu da.
Okay, let's go. Then let's go.
Interaktiv olsa, bir 30 minutdan köp olsa.
Okay.
Indi birinci soru aradadan ilk Tomacı. İngilizce okuyacak. Since ACE2 involved in both COVID-19 infection and in blood pressure regulatory system, wondering if individuals with high blood pressure are more vulnerable to COVID-19.
So the ACE inhibitors are the medications that are used for high blood pressure as well as the heart failure patients. So ACE and ARBs, they're two separate types. So when you are on this medication, technically all of your ACE receptors get medications block those receptors. So body upregulates the receptors and they produce more receptors. So technically it means that once you're on that medication, your body produces more receptors for angiotensin converting enzyme. And in theory, it puts you on more risk because you have now more receptors for the virus to attach. But the recommendations are if you're on that medication already, there isn't a mortality difference. So if you're already taking the ACE inhibitor or angiotensin receptor blocker medication, you don't have to stop them. But if you are diagnosed with COVID-19 and if you need to be on to put a new blood pressure medication, it's better to avoid those medications while you're sick with COVID-19.
Maksat amaniyelli soraptır. Men paraphrase edecek. Virus mutate ediyemi diye. December'daki virus ile Şubat'taki virus denmi ya yütküyemi.
So in China, the studies have shown that there are 103 strains of coronavirus. There were two different types, L type and S type COVID-19. So in the beginning of this epidemic in China, the majority of the cases were L type, but the strains that we identify in the United States are mostly S type. So it is a little different from China, but they suspect that there is going to be some sort of mutation, genetic mutation, but it is not as significant as flu.
Okay, Şvasi'den sorulara cevap vereni de mümkün olsa hemmek düşünüyor ya Türkmen diline cevap vereyim diye.
Okay. Türkmen çoğalı ya bana yavaş gidiyorum şu an senin ne
Param gatılmıyor hokman eller C type eken L type eken bağır köpümün düşünecekler yok yani hani aramızda düşünenler olmalı. İnnik soru anonymous attendi. Badan sonra geliyor. Bu keteler karşı sancım yağdayına hil olur kadiye. Sancım taplayın yağdayına hemmelere haçan el yeterli olur kadiye.
Haçan el yeterli olur onu bilemedim yani. 4 tane dünyada kampanya var şu an sancım işlerini alıp barayan. Ulu devletlere sancım ediyen işlerini alıp barayan firmalara maddi yağdayda köp padyaşkı veriyor. AstraZeneca Anglia'daki ben geçen havalarda okudum. Amerika'daki the Johnson & Johnson they start testing on healthy people. It means that they are progressing, but I'm not sure. Haçan effektiv du belli olar on hakkında toşne informasyam yok.
Inni what is herd immunity? Herd immunity nämolja för immuniteti.
Aha.
Şu arada azıcık kurrungara engdiye terdar.
Herd immunity demek var aydıl şiali. Well, you don't do the social distancing, stay at home orders that strictly, and you let everyone get sick. So older people with comorbidities get sick and then die, and the younger people who get disease, they recover, and all of a sudden, the majority of the population is already has been exposed to this disease and produced antibodies. It means that once the reinfection from that virus will not be as dangerous as someone who never been exposed to.
Procent var mı şu herd immunity için mesela 70%'ına emmek şey yoksa normal ya 80%'ına yoksa normal.
60% diyen bildim yani.
Düşünün. Böyle. İnnik soruda USA'nın COVID-19 virus babatında statistikanın köp yurtun hat yaramaz yağdayda bolmanın düyüp sebebi sağlık sistemasıyla bağlanışıklı diye şamrat kurban tehedif.
It's, I think.
Amerikan sağlık sistemasını düşünecek olsana.
Yo, ne men hani öl pikrim. It has nothing to do with evidence-based. Men öl pikrim hakkındaydı. Amerika'da, how do you diagnose people? When do you get the numbers? How do you get the numbers? So if you test a lot of people, your number of cases is going to go up. So Amerika dünyada ilk devletlere garanda köp kişinin test ediyor. Hani diyeli neme karaya şunca test etti da değil yara. Test hani yani Amerikan karaya göre hat köp şu var. So we test more people, we diagnose more people. So other countries in Africa, you know, people die and they don't know why they die. So it's men fikrim devletlerim, they hide their statistics, and we don't. Here we don't. Men fikrim bilmedim.
Eğer mild bolup geçen yadayına diye virüs yok şahin yadayına 3-4 hep de recovery'ye ulaşmak için vakit geçirdiydiniz diye. Fakat eğer uyda olsan uyda ne etmeli? Bir masaya sorayım.
Uyda olsan işte the prevention in home settings. I'm gonna just bring it here. Isolation at home using separate bedroom and bathroom. You know, patient and caregivers maske giymeli. Eğer hani aynı otoda olsalar ya da aynı maşinle seyahat etseler. The limit number of caregivers and minimize patient exposure to shared spaces. If they can use their own bathroom, do it. You know, don't let them to come to the living room. If you have to be in the same areas, the shared spaces in home, make sure you have the good air conditioner or open the window, and also the hand hygiene, and try to stay 6 feet away. And that's the when you stop doing the probably someone is going to ask about it when you stop the isolation and whatnot. So iki şekilli demesi var recommendation'ı CDC'nin. One is test-based strategy, the other one is symptom-based strategy. Eğer diyeli sen test ettin, sen koronavirüs bilen bağlanış diagnoz koyuldu. When you stop doing the social distancing and then the isolation at home. So eğer sen gıdgının ayrılsa, hiç derman almasadan ve sen öykün simptomla ulaştı, üskürüğün gaklık çıkaran olsan onun ulaştı ve 2 tane negatif yankı nasal pharyngeal swab PCR testing, 2 tane negatif testing idliğine olmalı. Eğer şöyle 3'ü olsa, you can stop doing isolation. The other one is system-based strategy. eğer ilk simptom başlanandan son 10 günden son ve eğer sen symptomlang you stop having symptoms anymore after 3 days after. So you have to satisfy both of them. So ilk symptom 10 günden olmalı ve sen diyelim you no longer symptomatic and you have to wait 3 more days. And then you can stop isolation.
Okay. Gördünüz hasta becer gördünüz mü diye COVID-19'ni?
O bizim hospital'da bir binani COVID hastanesi ettiler. 200'e yakın hasta vardı. Biz anesteziyoloji böyle department we do all the intubations that if patients cannot breathe, we put that breathing tube in and they connect to the machine. So that's considered the high risk procedure, aerosolizing procedure. So in the first, I think 2 weeks, I worked as a hospitalist, like on floors, and then I worked a week in the ICU, and then I was part of that intubating team. It's getting better though in our hospital. We used to have at least 200 people. Now, as if last week we had only 80 people. 40 people left. So it's coming down numbers.
Okay. Asymptomatikler varada gurlaplartın hem gowher hem rayba. Olar öldürnün gowlaşanını ne bilmeli?
Asymptomatic it doesn't CDC and WHO does not recommend that you get tested. You just do social distancing. If you're asymptomatic, there's nothing to do. But if you sometimes those people patients go to how do they get diagnosed? They go to doctors for some other reason, and they get, let's say, someone goes to the emergency room with belly pain, and they get a CAT scan of the belly. Then when they get CAT scan of the belly, that captures the lower lung fields. It's like then they see the infiltrates in the lung, and then they test. Oh, it looks like coronavirus, and then you get tested, and you end up being positive. That's how you get tested. Otherwise, it does not. It's not recommended that you go and get tested if you're asymptomatic. You just do social distancing and all those measures that public health officials recommend.
Dildar soruya COVID-19 tuberkulozdan näme tapawdy we howada näçe wagt galydy?
Tuberculosis, it's a bacteria. It's Mycobacterium tuberculosis. It's a chronic disease. The coronavirus is a virus. Tuberculosis it has treatment. You get treatment for 6 to 9 months, and you get cure. Coronavirus, it's a completely new virus that infects lungs, and the reason a whole lot of treatment that's recommended as of now.
Inni näme soralar? Temperaturan nähil täsir waka, ýagny inni Thomas güýz we gyşda nämeler bolar, şoňa nähil garaşlyar?
Temperatura hani jit eger han if the virus is exposed to extreme hot weather, it does the lifespan gets shorter, but I don't think it would happen with 38 degrees. In centigrade.
Cevap verdiğip duyduruyorlar yani de.
Eğer diyelim 100 gradus Celsius deme yanka expose etsen virüse on ömrü adalya yönü dışarıda 100 gradus bolcan nemesi yok. There is no point that it's going to be 100 degrees outside. So toşunu bilemedim de hani kağıdın üstüne yes it should go down, but then we are nememedi bana social distancing elektatlar goşad yes and then public health experts say that ikinci tolkun geliptiler diyorlar demede güz teori. It's possible, but I don't have an exact answer.
Düşünüklü.
Bağışlarsınız da Türkmençe hani I had all the medical education in Turkish and then in English. So hepsinin Türkmençe'ini bilen yok.
Düşünüklü.
Onu Türkmençe'ni öğrendim daha var.
Şalao. Asır Muhammed Serdar soruya. Meňiş möre droplet 2 metrden köp uzaklığı denok yönü droplet nuklei diýilýän 2 metrden köp gidip bilýän üçin adamlara üskürönüne tırtığının içine üskürmek maksat berilýär diýe şol dogrymy?
Üskürüňde tırtığın içine üskürsen, that means that your droplet will not even go to 2 feet.
2 meters.
Yeah, 2 meters. Yeah, 6 feet. Yeah.
6 feet tamam.
Yeah. Shongchun, honey, yes, it can stay for a few hours, but let's say there was a COVID-19 barhassa ang bolan otona ertetun gisseng girteng ten soloto the bash on galtang. Is there a risk? Technically, no. That droplet is gone already.
Düşünüklü. Zatlaň üstünde de galplenok many gapyň
demirleň üstünde galpylýar. It depends, the amount of the virus that you have to ingest in order for that to be infectious. Mm-hmm. You have to ingest certain amount of virus. So if there is only like 4 or 5 of them and you ingest that, you're not going to get sick. If there are like hundreds of them, then you're going to get sick. So they recommend that you wipe those like high contact areas in your house. If you have COVID-19 family member, that you wipe them, all the doorknobs, the switches, ish gapalare, haladin like sink, kran, you wipe on a daily basis with a disinfectant.
Eğer gutulan bolsaň ýa-da diýe asymptomatik bolsaň mutated viruslar bilen täzeden geçip bilýärmi diýip soraga.
Yeah, it's not well known yet because it's a brand new virus, so it's being studied. Mm-hmm. But the evidence shows that you get that it mutates way less compared to other viruses like flu. So they don't think it's that significant as if now, based on the information that we know, and that you get protective antibodies. So technically, you shouldn't.
Specific soru aradadan individuals taking blood pressure medicines aradan blood pressure var igen.
Muhtemel.
Angiotensin manipulators'lar more vulnerable mu diye hani olur yokuşmasa ihtimal kendi soru.
So if you already taking it, you should keep taking it. There is no increased risk. But when you take those medications, that the angiotensin and aldosterone system modulating medications, they are ACE inhibitors and ARBs, angiotensin receptor blockers. Those are both kind of similar medications that affect that system, renin, angiotensin, aldosterone system in your kidney. And so if you're already taking it, there is no elevated risk for you to get coronavirus. But in theory, if you're on those medications, the receptors, since those medications block those receptors, your body produces more receptors, upregulates those receptors. So in theory, you have more receptors susceptible for the virus, but the studies have shown that, if you're already taking it, there isn't a whole lot of increased risk compared to people who were not taking it.
Inni waqtymda malum bir soruň Birane men soraýarlaryny şu wagtda çaklama bir haýwan iýilip şoň süýlen geçipdir diýilýär-de. Şu virus şoň süýlen ýene geçip bilýärmi?
Yer ganatdan geçenli pikir edilýär. Bulan yer ganatlarda bu koronavirus badygy onun näşilden näre bilinýän barda. I think that's, it already happened, but it does now. The main problem that we get is from human to human. So we have to stop that. There is now we're gonna have this disease. We're gonna have it next year, the year after. It's just gonna be like a part of normal life, like flu.
Düşünükle. Şu edilen, şu atkalını parlayan tanzimler 3-4 tane tip adında CL başka hayf var bilemem. Şu tanzimler şolun hemmesine tesirli mi kaya mesela Amerikan işleyen tanzimi Amerika'daki virüsü Avrupa şonlarrak mı?
On I don't have a whole lot of details about it. But it would make sense that the US, if it's developing the vaccine for their own people, then it would probably be targeted to the strain that we see more here.
Kesinlikle. Olya köp savol hemmesine deneyal yerin soruğa cevap verdik. Bir soruğa olurken değişirler sizin nemäňize.
They can email me if they want.
E-mailin maglumatyňa bolsa paylaşay. Nemede?
Okay. I'm in chat together.
Olsa şonu şeýret. Bilsen ýa-da. Men ýene bir ýatladayın gatnaşanlara köp sowal gatnaşan üçin e-mailini gördüňiz. Özüne e-mail ýazyp bilersiňiz. Bir mümkin bolsa haýsy şäherden we döwletden gatnaşanyňyzy ýatsaňyz hala ýazdylar bolun. Başta ýyrak gelenler de nereden gatnaşanlarını biler ýalar.
That's funny. It says English düşündür versin ama Türkmen çağışta Türkçe urlayat. Yeah, I'm sorry guys.
Düşünüp aýana şuňaly Türkçäni men owa baramda bir ýaşly daýda da men bilen Türkçe urlaşa korpörtda Türkiýede okýarkan. Soňra nerden öwrendiň diýsem serial öwren eken Türkçe. Soňçy Türkçe gidaýende de düşünýän gatken kadýan.
Kıyna 2004'ten beri Türkmençe gepleşilen ondan kıyna. Türkmen yok yanımda 2004'ten beri.
Kesinlikle.
Olmasa men atamalım o koç atak bäbäş.
İnşallah atak bäbäş görýänler ola kellede taçalanlar.
Kim bilýär görelenler atam.
Doğru. Köp sowal Dr. Mas beren gurulmagyňyz üçin.
Sağ ol ha.
Inneki ýyl size nazar bermejek bolursa 2 ýyl üstü bolly.
İnşallah.
Oňa çenden virus meselesini çözersiňiz da.
İnşallah. Bolaya dönnen. Neden diyen adamı yok the intubations.
Düşünükler ya ýoluňa düşse de bir doktorluk işiňiz bolsa habarlaşy bermeli.